So I keep on mentioning that she's my medical student because I'm so proud and I like to take credit for that, but I really can't take much credit for Grace. But Grace Charles is a family medicine resident at Overlook Hospital in New Jersey. She attended medical school at Mount Sinai, where she completed coursework in holistic healing and alternative therapies in medicine. She is a certified yoga teacher and incorporates yoga therapy into her medical work. She conducted research and published on the presentation and management of hyperkalemic periodic paralysis and currently serves on the PPA board. So, without further ado, it's really ado, right? It's ado. Adieu. Okay, bye. Thank you.
Hello, everyone. Today I'm going to speak to you about integrative therapies for periodic paralysis. So rather than start off by defining what integrative medicine and those therapies are, I thought I'd start by letting you experience it yourself. So for these next few minutes, we're going to do a short meditation series. So if everybody could please get comfortable in your chair. We're going to just sit for a few minutes, and we'll discuss afterwards how this relates to periodic paralysis management. So finding a comfortable position, both feet flat on the ground. If you have your legs crossed, uncross them. Let your spine extend long, head of the crown of the head towards the ceiling. And let your forehead and jaw relax. Your vision relax, your eyes can close. And let your spine be long, your limbs relaxed like a coat hanging on a hanger. And begin to focus on your breath. Without needing to change it in any way, note the inhalation and the exhalation. Notice how it feels as the cool air enters your nostrils, and as the warm, more humid air exits your nostrils. And notice how your chest rises with the inhalation and falls with the exhalation. How your belly expands with the inhalation and falls with the exhalation. And thoughts may enter your mind, and if they do, that's okay. Just gently let them go. No commentary. And return your attention to the breath. Let the breath breathe itself, and follow each breath. Follow the inhalation through the nose to the lung and the belly. And notice that pause between the inhalation and the exhalation. And then follow that exhalation out, the lungs, the nose. And again, if thoughts arise, notice them, be aware of them, but let them go. No judgment or commentary. Simply breathing. And know that at any time when your mind starts to fill with thoughts, or you start to feel anxious or like you're losing control, you can always anchor yourself in this present moment by coming back to your breath. And let's count 3 more breaths now for ourselves and begin to return our attention back to the room. Returning refreshed and alert, and you can open your eyes when you're ready. Okay, so that was an example of an integrative medicine modality known as mindful meditation. We'll discuss more soon the health benefits of that and how it relates to periodic paralysis. Integrative medicine is a branch of medicine that approaches healthcare with a holistic outlook. We approach patients looking at their physical, mental, and spiritual health. And we do this through a multitude of therapeutic modalities. So some are those you're familiar with. Medications and the standard of care practices that you've most likely heard about from your physician. Integrative medicine also includes a focus on nutrition, yoga, massage, acupuncture, biofeedback, meditation, and other more alternative modalities. So as you can see, there are many therapeutic options when it comes to integrative medicine. So it's a very individually tailored thing. What works for some people doesn't work for others. So I encourage you to keep an open mind as you hear the presentation today and notice what in specific speaks to you, what you hear about that you think really would connect with you or be something you would like to try. Because no doubt some things will speak to you more than others do. And something I really appreciate about integrative medicine is it's low cost. Most everything, like that short meditation sequence we just did, doesn't cost much or anything at all. And it puts a lot of the power in your hands as well. It's something that you don't need to be somewhere at a specific time, in a specific place to do it. You just take a little of your own time when you're ready, when you're needed, and take care of yourself. Integrative medicine is really an up-and-coming field. A lot of research is coming out about it. Most major medical institutions are opening centers for integrative medicine, including Duke, Mount Sinai, Penn, Harvard, UCSF. And I wanted to mention a study that recently came out of UCSF where individuals with chronic pain, intractable chronic pain, that they're having difficulty treating it, took part in a study where they underwent integrative medicine therapy. And individuals over 8 weeks reported an over 20% reduction in their pain severity, as well as better quality of life, including better mood, diminished fatigue, and superior sleep. Now, when it comes to periodic paralysis, standard medical treatment is the cornerstone of your therapy. Avoiding your known and suspected triggers, treating attacks, and preventing those attacks usually with a diuretic, that's your standard medical treatment. What I'm suggesting as far as integrative practices is there are components of periodic paralysis that are more under your control. And these include anxiety, pain and muscle cramping, stiffness, and stress. We'll touch today on 3 major categories of integrative medicine: mind-body medicine, nutrition, and physical medicine. When it comes to mind-body medicine, that's a category where you can learn to diminish your anxiety level, to reduce stress, and to control pain. In our research on hyperkalemic periodic paralysis, emotional stress was the 3rd most common trigger of attacks. It was mentioned as a frequent trigger by about 50% of study participants. And when you're emotionally or physically stressed, your body releases stress hormones. And that could be part of what triggers the attack. So it is something emotional, but it causes a physiologic response. And in addition to triggering an attack, stress can be elevated, of course, during an attack, which may exacerbate the attack. So learning to coach yourself during an attack to diminish stress could be helpful as well. Pain, of course, is it's part of being in the conscious state. It's something that our minds are aware of. So mind-body medicine also helps to control pain through controlling your experience of the pain. Nutrition is something we'll touch on as far as using your diet to optimize muscle composition and therefore function, and as well as decreasing inflammation and pain. And finally, we'll discuss physical medicine. Physical medicine includes practices you can use to increase overall musculoskeletal strength, to reduce stiffness and improve flexibility, and finally, to improve balance. Balance is one of those things, if you don't use it, you lose it. And especially if you're experiencing asymmetric weakness at times, or things like that, it's important to have your balance as intact as it can be. So we'll start with the discussion of mind-body medicine. Hippocrates once said, "The natural healing force within each one of us is the greatest force in getting well." And I think that really speaks to what mind-body medicine is. Mind-body medicine uses the power of thoughts and emotions to influence physical health. And there really is a connection between your mind and your body. For instance, depression is associated with slowed wound healing. So having that emotion, that state of being depressed, actually causes at the cellular level a slowed response to healing. Hostile attitudes are also associated with adverse medical conditions. And especially when it comes to periodic paralysis, individuals right before they have an attack, during an attack, and after attack report being more irritable. Unfortunately, that's associated with heart disease, obesity, prediabetes, and high cholesterol. So being in control of your irritability, learning to let that go, can actually have other positive health benefits. And finally, I wanted to mention how a person deals with their emotion actually affects survival of their chronic illness. At Stanford, a study was done with women with late-stage breast cancer, and they were divided into two groups. One group received their standard medical therapy. The other group received standard medical therapy and attended a support group. A simple support group where twice a week all the women would meet together and discuss what was going right and what was going wrong in their lives. So what do you think the difference between the outcome of these two groups was? Well, in fact, the group who attended the weekly support groups survived twice as long as those who didn't attend the support group. So by coming here today, you clearly just doubled the rest of your lifespan. Great job. But in all seriousness, so we have the PPA and the PPI, these two great organizations, and in taking part and coming to events like this does serve as a great vehicle for social support, as does participating on the discussion board and reaching out to each other. So as I mentioned, there are a host of techniques in integrative medicine, and now we'll discuss some of those in mind-body medicine. One of the most common ones you've probably heard about is cognitive behavioral therapy, where an individual meets with a therapist. And the whole idea behind CBT, cognitive behavioral therapy, is that even though your situation might change, maybe you have a rough diagnosis to deal with, or something totally different, you have to deal with difficult people every day who don't understand you. It's your thoughts that determine your feelings and behaviors. So the therapist works with you to change your negative beliefs and behaviors and replace them with a more positive outlook. The one thing I would say about CBT, it's one of the therapies that can become kind of pricey over time. So that's something to consider when looking into it. Next I want to mention is biofeedback, and you see it in the picture there. With biofeedback, you're hooked up to a machine that shows you something about your internal physiologic functioning, which you otherwise wouldn't be aware of, such as you may be hooked up to EMG, which is showing you muscle contraction that you normally wouldn't be aware of. And the idea is a therapist will walk you through meditative techniques to help you learn to relax that muscle. So even when you're no longer hooked up to the system, you know what techniques to use to relax. And finally, breathing is a surprisingly effective mind-body medicine technique. Studies have shown that when you decrease your breathing rate, you're able to tolerate more pain and for longer periods of time. So the studies they've done in particular is they have the breathing rate. So normally people breathe 12 to 16 times a minute. So if you breathe closer to 6 times a minute, your pain threshold is higher. And I've found this really effective in my own clinical practice when I'm doing a procedure on someone that's kind of painful, and I start saying, take a deep breath, and I'll count for 10 seconds each breath. So that's about 6 breaths a minute. And most definitely, I mean, it's amazing how much better people are able to tolerate the procedures when they just start breathing more slowly and more deeply. There's also some new research coming out that if you do this several times a day, just as a practice, a daily practice, that it helps people to deal with chronic pain as well. Hypnosis is another mind-body technique that employs the power of suggestion. A therapist gets you in a deeply relaxed state and suggests things to your subconscious so that even when you're in your normal awake state, they should have an effect, such as it's commonly used in anger management. So people who feel like they have hostile attitudes, like we discussed earlier, this can help you to be to reduce the level of hostility you feel. Progressive muscle relaxation, it creates awareness of muscle tension. The way this exercise works is you lie down and from head to toe you contract each muscle for about 5 seconds and then let it relax, going from the forehead all the way through the toes. I personally found this to be pretty impressive as far as the awareness, the body awareness it creates. After I did it a couple days, I would notice more, oh, my shoulders are tight, I need to let them relax, or I'm clenching my jaw, I need to let it go. So unless you think it would trigger an attack, I would recommend trying that maybe and seeing what effect that has on your muscle tension. Spirituality is a really interesting topic. Research has found that people's beliefs and practices, specifically spiritual practices, affect their health. Those with chronic health conditions who reported being religious, having compassion for others, or a sense of inner peace have actually outlived their colleagues in cohort studies comparing people with these practices and beliefs compared to those who didn't have them. And finally, we'll discuss meditation. In the US, at least, there's 2 common forms of meditation, particularly in the medical setting: transcendental and mindful. In transcendental, the idea is to just sit there and mentally repeat one word over and over again. And the idea is to come to this state of effortless calm, where by saying this one word over and over again, you're not paying attention to anything else. You just have this pure state of mind. Mindful meditation is that practice we did earlier. And the idea there is to uncouple the physical sensation from your emotional and cognitive experience. So for instance, as we said before, during that practice, if a thought would arise, you would be aware of that thought, but you wouldn't let it affect your attention on the breath, your continued calm state. And just like that thought could be something about pain. I'm feeling pain here, or a discomfort here. And the idea is that while you're aware of that, you're not denying it, but you're not letting it affect your mind. And there was a study done where they individuals with chronic pain took part in an 8-week mindful meditation course, and 4 years later, 72% still reported moderate to great improvement in their pain severity. Next, I wanted to touch on nutrition. Nutrition, just like the pills you take, the foods you eat are comprised of compounds that affect the way your body functions. And you can use your diet to encourage muscle growth and to decrease inflammation at the cellular level and ultimately pain at the conscious level. To promote muscle growth, researchers have found that including 25 grams of protein at each meal optimizes muscle production in the body. And this goes for both young individuals and older individuals as well. As far as decreasing inflammation and pain, omega-3, increasing the amount of omega-3 fats in the diet has found to be beneficial for individuals with various inflammatory disorders. The idea is that our bodies would prefer to have a certain ratio of other fats to omega-3s, and the standard American diet doesn't include enough omega-3s for our body to create cells with its preferred ratio. So by increasing the omega-3 fats, either by taking a supplement, usually about 3 grams per day, or by increasing omega-3s in your foods, taking in cold water fish, flaxseed oil, walnuts, you can optimize your cells' anatomy and therefore their function. And they found that individuals are able to take less non-steroidal drugs like Advil, anti-inflammatory drugs, for pain when they increase the omega-3s in their diet. As far as B vitamins, vitamins B2 and B6 are particularly beneficial in decreasing muscle cramping and spasms, so I wanted to draw your attention to those. And finally, as far as antioxidants, in individuals with osteoarthritis, they've been able, by increasing antioxidants, and in particular vitamin E in the diet, to improve their range of motion in the joints, and as well as decrease their pain medication regimens. And finally, we come to physical medicine, which, just as the name implies, is about physically manipulating the body. Commonly known forms are heat, massage, and yoga therapy. There's a lot of research, and I would say anecdotal evidence, showing that superficial heat is really great for muscle pain. Usually dry heat or wet heat are both good, so taking a heating pack and resting that on a sore muscle, and likewise sitting in warm water can help relax the muscle if that's an option for you. And it's particularly beneficial when used right before massage to warm up the muscle and then massage it. And anyone who's had a massage knows that it relieves muscle tension, it feels good, and it reduces stress. You feel mentally better after a massage. And massage, in fact, is equal in efficacy to getting physical therapy, as well as wearing corsets for low back pain. And finally, we come to yoga therapy. Yoga therapy is, of course, as a yoga teacher, my favorite subject to talk about. I think it incorporates all of what any one individual needs as far as integrative medicine. It's the application of yogic postures and principles in conjunction with breathing and meditation to encourage strength, flexibility, peace of mind, and overall well-being. So it really hits on everything there. The poses in yoga promote strength, flexibility, joint lubrication, and balance. And the great thing about the poses is that they enable you to have a routine. So you can have the same routine that you practice daily, or you can mix it up once you're familiar with a few of the poses. And no equipment is required to do this practice. So to get everyone moving and to show you exactly what yoga therapy is, I prepared a little chair yoga for us all to do together for about 10 minutes. As with any practice, physical practice, do what you can do and don't do it if it hurts or if you think it might trigger an attack. Feel free to modify anything you want in any way that's most comfortable for you. And so you're aware, some of the poses are stretches, so you'll be holding some of the stretches for a few seconds on each side. We won't just let everything go right away. As far as yoga therapy goes, as I mentioned, it's physical, but it's also mind-body as well. So I find it beneficial when I'm starting my practice, my yoga practice, to set an intention for that practice. So I listed on the slides some common ones that I use. So one is making space in the body and mind. And it's just the idea that we're always a little hunched over, shoulders are kind of contracted in. It's the idea of opening up with a broad chest, sitting up straight, making space in the body, as well as the mind, letting go of nagging thoughts or concerns, just letting there be space there. Another one is letting go of thoughts that concern you, of things you have to do, and letting go of tension in the body. Breathing, just as we use during mindful meditation, is another great way to set rhythm for your practice and to create a feeling of calm. And finally, one I like to use is gratitude, because anytime you spend a few minutes thinking of everything you're grateful for, you end up in a better mood at the end. So maybe for today, since you're all here at the PPA conference and having a great time, you can think about what you've enjoyed so far and what you appreciate about the conference. So I originally was going to try to do it with you guys, but it's difficult to hold the microphone at the same time. So I created a little video of me doing it, so I'm going to do it along with you while I walk you through it, okay? All right, so if everyone could sit in a way that you can participate in the chair yoga, you will have to stretch your legs out a little bit. So if you're at a table, you might want to turn just a bit away from the table. And have a little space from the person next to you so you can reach your arms out to the side. Okay, so let's start with both our feet planted on the ground, legs not crossed, feet about hip width apart, and try to sit on the front edge of your seat. And sit tall with the spine erect, creating space across your chest. Let the crown of the head reach towards the ceiling, the shoulder blades pull a little back. And you can start by closing your eyes and placing both hands on your belly. Just feeling the breath as your abdomen expands and contracts. Setting your intention for this practice. And letting that go, you can open your eyes, and we'll start by coming to a neck stretch. So, taking your head, rest your right ear towards your right shoulder. And that left shoulder may rise up, so let it drop down. Encourage it to stay relaxed. Oh, sorry. Actually, let's start with neck circles. That's what I get for not looking at the screen. Okay. So just roll it one way and then the other. Let's warm up before we stretch. And coming back to center. Now let's drop the right ear towards the right shoulder. And you can take your hand onto your ear if that's comfortable for you to allow a little bit more weight to pull your ear towards the shoulder and wrap that other arm behind you. And when you're ready, turn your head to look under your armpit, right armpit, for a slightly different stretch. And when you're ready, let that go and come back to center. And we'll do the other side. Left ear to left shoulder. Bringing that arm up if you like and wrapping the other arm around the body. Keeping that right shoulder down, not letting it rise up. And you can turn to look under your armpit for a slightly different stretch. And let that go. And now we're going to come back to center and do a side body stretch. So raising the right arm up high, and lean over as much as comfortable for you. And keep that right buttock pressing down into the seat because it's going to want to come up. But to get the most out of that stretch, keep it down. And coming back to center, we'll do the other side. Left arm up, reaching over the body. And if it's comfortable for you, you can look up at your hand. With the exhale, let that go. Releasing any tension that might have arisen in the jaw or the forehead. And now we're going to warm up the spine. So on the inhale, you'll point your chest up towards the ceiling, and on the exhale, you'll round your back behind you. So inhale, really arch the back, reach your head up towards the sky, and on the exhale, press your belly button into your spine. This is called cat-cow, this pose. So when you're rounding your back, you're like the cat, the angry cat. And come back to center when you're ready. Taking a moment here to check in with your breath and your intention. Now take both hands, interlace the fingers, and stretch your arms above you for a full body stretch. So keep both buttocks pressing down into the seat as your palms press towards the ceiling above. And those shoulder blades, they'll want to rise up. Keep them pressing down, away from the ears. Make sure the jaw is relaxed. When you're ready, slowly exhale the arms down. Now we're going to start warming up a little bit more. So we'll do a sun salutation. So you're going to inhale and you'll reach both arms out to the sides and then up above your head. And okay, inhaling up. And on the exhale, you'll dive forward between your legs. And you'll inhale and come back to sitting. Take a moment. And then again, inhale, arms above you. And exhale, diving down. Inhaling back up to sit. And inhaling the arms up. Exhaling to dive forward. And inhaling back up to sit. Now we're going to move the legs a little bit. So just reach your right leg out straight in front of you. And if you prefer not to use your legs, you can use your arm instead. So flex and point the foot, or if you prefer, flex and point your hands. And then circle it one way, and then the other. And let that go, and let's switch sides. Pointing and flexing, and then rolling one way, and then the other. And letting that go. Now we'll come to do a seated spinal twist. So take your right leg and cross it over. Now we're going to do a core strengthening pose. So you'll take both feet and lift them up off the ground, holding onto your chair. And this is a pose that requires both balance and some core strength. And when you're ready, you can let that down. And now we'll come into a seated spinal twist. So take your right leg and cross it over your left. And take your left arm and push it against the side of your knee as you turn to the right. You can use your chair behind you to pull yourself back. On the inhalation, rise up, feel your spine extend long towards the ceiling. And on the exhalation, you can turn even a little bit more. And let that go when you're ready, and we'll switch sides. Again, using the inhale to grow tall, and the exhale to advance the stretch. And remembering your intention and your breath. And on the exhale, let that go, and we'll come back to a center seated position. And from here, widen your legs a little bit more apart and just come to a seated forward fold, letting your head hang. You can clasp your elbows, one hand on each elbow, or even rest your palms on the back of your head to stretch your neck a bit as you hang there. And slowly roll up when you're ready. Let your eyes close. Taking a moment to check in with how you feel from this practice. How your body feels differently than when you started. And I encourage you to think about, for this moment, to reflect on what you've heard in this talk. If there was anything in particular you found interesting or enjoyed, maybe you can make a commitment to yourself to try that at some point. And I hope that I can hear about it. If you would like to share with me on the PPA discussion board, I'd be really happy to hear from you. And opening your eyes and coming back to the room when you're ready. Thank you very much.